I've gotten some questions recently about meniscus tears and dealing with it at a surgical approach. And the interesting piece about dealing with meniscus tears is that you have a mechanical dysfunction with the knee, meaning that there's pain that can come at any time because of the loose piece of meniscus that is either flapping or moving around in your knee. There's several ways to look at it. Depending on the degree of meniscus tear, and usually if meniscus tears are smaller, even your doctors and physical therapists will say the body has the potential of healing that or dealing with that. If you have a bigger tear in your meniscus, it's important to address it from a surgical approach and get that fixed, because in incorporating my approach in dealing with it as far as comfort goes, you can take the knee to comfort and get the knee out of pain, but if you have that flap going on in there in the meniscus, and just in case I didn't cover this, the meniscus is of course the piece of cartilage that is the shock absorber between the bones in your upper leg and the bones in your lower leg. And occasionally they kind of look like two suction cups, the grooves that your bones will ride in, the bones in your upper leg and the bones in your lower leg. And what happens is sometimes the bones will slip or catch the edge of that suction cup and it'll tear. And when it does tear, that of course causes pain. And depending on the degree of tear, you may or may not need to get that addressed. This, of course, is something you would discuss with your doctor as to what your options are. Once again, they generally say with a 1/4 inch tear or less that you may not need it fixed, depending on how much pain you're in, how often it reoccurs. However, if it's greater than a 1/4 inch, a lot of times they suggest arthroscopic surgery. And arthroscopic surgery is, they'll have a couple of holes in your knee where they'll have a camera and the cutting tool and the suction, and they'll go into the knee to repair the meniscus. That's generally outpatient surgery that gets that done in a day. It's good to get that fixed. However, you have a couple of instances of why you'll feel pain afterwards. One is you have the sensitivity in the area that was cut. Anything. If you have a blister and the blister heals and you pull that skin off of the blister, even though the blister has been fixed, there's still sensitivity with that. You could think of it the same way when they repair the meniscus. They're going in there and cutting part of that meniscus off to make it smooth so it doesn't catch anymore. However, it's still going to be sensitive. There's a part of your body that's been cut. So you have that pain associated with what's going on in your knee. However, you also have another pain, and that is generally the tension pattern that your body holds on to as a result of protecting itself from the initial injury, the fear of stepping and that knee's going to hurt again. That's your body's natural reaction. Like when you touch your hand to a hot stove and your body tenses up to protect itself from that hot stove, it pulls the hand away. Your body does the very same thing in the knee. When the knee hurts, your meniscus is torn, it doesn't want to go there. And there's this cascading effect that goes through the entire body as far as how your brain thinks about the way you walk, how your nervous system will kick in and, tension, it'll affect your adrenals, it'll affect your digestion, it affects all sorts of other mechanisms in your body, not only your knee. However, once the knee is mechanically fixed, the meniscus is repaired, then we can start addressing the tension patterns that are going on. So many times you'll see, you may have experienced this yourself, you may have seen many other people that have had arthroscopic surgery. The knee is mechanically correct. You'll go an X-ray, you'll have an X-ray, a CT scan, or an MRI, and the knee will be fine, yet you still have pain. And the pain that you're experiencing are the nerves that are being squeezed. Like your nerves are as tiny as an eyelash. And when when the body tenses up to protect itself, it squeezes on those nerves, and every time you walk, it causes that grating and irritation. So I've had friends who had arthroscopic surgery, and it's years after the surgery, and they're still having pain in their knee, even though the knee is fixed. So it's important at that point, once the knee is mechanically sound, meaning the arthroscopic surgery has taken place, there's no more meniscus that's flapping around there, then you would want to go in and work with my program, the Comfort Zone, which is getting the pressure off of those nerves in the knee. That's going to address those tension patterns that are causing the grating on the nerves, causing the pain. It causes the knee joint to squeeze together. You'll have the narrowing of the joint, and then you're on that slippery slope towards the knee replacement surgery down the road, because now the meniscus begins to wear, the cartilage begins to wear, the joint begins to squeeze tighter together, so it squeezes the fluid out, the synovial fluid, the blood and the oxygen that's able to get into the knee and fix that. So that's really my approach when I look at what's going on regarding a meniscus tear. We got to get that addressed first from a Western medicine approach. Make sure the knee is mechanically sound. Once that knee is mechanically sound, then we need to address those tension patterns that are going on that are causing the pain days, weeks, months, even years after your meniscus surgery.